The mean arterial blood pressure is the overall blood pressure within your body. It is equal to cardiac output times total peripheral resistance, where cardiac output is the volume of blood ejected by the heart per minute, and total peripheral resistance is the combined resistance of all of your resistance arteries. We use this equation to understand how the mean arterial blood pressure is regulated. To get the actual value of the mean arterial blood pressure, we would use this equation, in which mean arterial blood pressure equals diastolic pressure plus 1/3 of pulse pressure. Now, pulse pressure is the systolic pressure minus diastolic pressure. So if your systolic pressure is 120 and diastolic pressure is 80, then your mean arterial blood pressure is 80 plus 1/3 of 120 minus 80, which is 40. And it's going to be around 90 millimeter mercury. The total peripheral resistance, I've already talked about it in one of my previous videos, but once again, total peripheral resistance, this one here, is the combined resistance of all of your resistance arteries. So I've said before that this is a parallel tube system, which is exactly what you find within our body. A single vessel, an arterial vessel, branches off and forms many parallel arterial vessels. If we constrict, so if these here represent the resistance arteries, if most of the resistance arteries constrict, our total peripheral resistance will increase, because total peripheral resistance, as its name implies, is the total resistance in the periphery. If the resistance arteries vasodilate, the total resistance in the periphery is going to decrease, because as you can see, there's less resistance here, more resistance to blood flow here. So let's look at an example of blood pressure regulation. We're going to consider hemorrhage or blood loss as an example, and we're going to consider, let's say there's some lesion in the stomach that's causing an internal bleeding. So what's the first thing that will happen is, of course, a decrease in blood volume due to blood loss. Now, when the blood volume decreases, venous return to the heart is going to decrease. Now, the reason for that is because venous return is directly proportional to blood volume over venous compliance. So if blood volume decreases, venous return decreases. Venous compliance is really the distensibility of the veins. So a vein that is constricted is going to be less distensible and therefore be less compliant, and thus will increase venous return, whereas a vein that is dilated is going to have an increased venous compliance because it stores more blood and therefore decreases venous return. So a decreased blood volume is going to cause decreased venous return, and the decreased venous return is going to cause decreased end-diastolic volume because less blood is returning to the heart. So if end-diastolic volume is decreased, then stroke volume is decreased, because stroke volume equals end-diastolic volume minus end-systolic volume. Also, decreased blood returning to the heart, according to the Frank-Stalling law, is going to cause the heart to contract weaker. If the heart contracts more weakly, that also shows that the stroke volume is going to decrease. The decrease in stroke volume is going to cause decreased cardiac output, because cardiac output equals stroke volume times heart rate. A decrease in cardiac output is going to decrease blood pressure. A decreased blood pressure is going to decrease blood flow to the tissues. And if there's decreased blood flow to the brain, that will almost immediately result in symptoms such as lightheadedness, nauseousness, fainting, coma, or death. So this is what happens when we lose blood. Now let's see what is the response of the body to the decreased blood volume.